welcome. My name is Sosamma Samuel-Burnett. I'm the founder and president of Global Justice, and we're here today with both an online and on-site viewing of our COVID-19 research presentation. Our COVID-19 research has been a study that was 1 year conducted by a team of individuals from our organization at Global Justice. This particular presentation and the research project is entitled The Unintended Consequences of COVID-19 on Vulnerable Women and Children. Our intent in sharing this particular presentation and this particular research is to show how COVID-19, a global health pandemic, could have implications and impacts on women and children in various vulnerable situations around the globe, and in ways that people don't necessarily realize or consider when we're dealing with just the health aspects of this particular pandemic. So we are going to be focusing in on a number of different key areas: education, employment, and health. We are also going to be focusing our research on 5 different countries that we studied in a comparative way based on their varying development levels. Throughout this presentation, you'll have opportunities to hear from a number of different presenters. If you're joining us from the online forum, we encourage you to participate using the question bar that you have. Throughout the program, we'll be monitoring those questions, and at the end of our program, we'll have a chance to respond to those questions as time permits. If you're here in our in-person audience, we encourage you to also log on so that you can also submit your questions. But please know that we'll also have in-person opportunities to engage with you. This whole presentation will last 2 hours, and we are looking forward to filling that time, but feel free to stretch your legs and do what you need to do to enjoy and to focus in on what we're presenting. I want to start, before I do my segment, to introduce our other panelists that they'll be on screen with me a little bit later on. First of all, after my presentation, we'll have Emily Winn joining us. Emily Winn is our outreach associate, and she'll be providing an overview of our health segment. She'll be talking about the global pandemic and kind of the implications of this health pandemic all over the globe, but also looking at some key facts and figures. Following Emily Winn will be Lauren Moustakas. Lauren is our program associate for our Women Empowering Women project. And in that area, she's focusing on advocacy specifically for vulnerable women. In that context, she'll be sharing about what's happening with this issue of COVID-19 in various countries and specifically for women. Finally, we'll have Greer Newman, and Greer is presenting as our program associate for children's advocacy. She'll focus on similar types of presentations as what you'll hear from Lauren, but particularly for children. Finally, we'll have some time to look at some conclusions and implications as well as recommendations that come out of our presentations. Following that will be our Q&A session together. So with that, let's go ahead and get started. So let me start with the title that we shared with you earlier. This research project is entitled The Unintended Consequences of COVID-19 on Vulnerable Women and Children. What I want to make sure that we all understand is sort of the context and content of COVID-19, but also some definitional terms such as vulnerable, for all of us to have the same understanding of what we're going to be presenting and why. So let me start with the global pandemic. We're going to use the time frame of approximately February 2020 to the present to understand this global pandemic's reach. There have been many other global pandemics. Think of, for example, HIV/AIDS, H1N1, and other types of concerns that we've had over the years. Many of them have been very, very deadly, some even more deadly than this particular global pandemic, and many of them have spread across the globe. But very few, if any, have the duration that we've had with this particular global pandemic. So even though it had its height in earlier years, we are still in the midst of the global pandemic. Currently, it has affected 223 countries and territories around the globe. Now, this is pretty dramatic. While we have had other pandemics, not all of them have spread quite so extensively as what we have with COVID-19. So regardless of whether these COVID-19 concerns are larger or smaller in different areas, the reach of this has been significant. There's been a reported 420 million cases worldwide. Now, percentage-wise, if you know the world's population, we're at close to 1.7 billion people. So 420 million is a considerable number of those people. The other major number is that we have had 5.86 million deaths worldwide that are connected to COVID-19. So COVID-19 has become and is seriously a very considerable threat to the globe. COVID-19 and the global pandemic has also created an unprecedented, what we call geopolitical phenomenon. This unprecedented phenomenon is because it has affected political, social, and economic issues around the globe, and not just in terms of health. So all of these arenas have been touched by this particular pandemic. Now, we are focusing in on vulnerable populations. So as much as we have talked about COVID-19 and the implications of COVID-19 more broadly around the globe, our focus has been on vulnerable populations. At Global Justice, we want to make sure that people who are in the most vulnerable situations are protected and served and supported. COVID-19 is one of those situations that affect men, women, and children from around the world, and in this case, in varying circumstances in various regions of the world. They've also particularly been affected by those that are in vulnerable situations. So if you're a man, woman, or child in a vulnerable situation, you are more likely to be affected by COVID-19, not just in terms of health, but in a number of other ways. These vulnerabilities make these individuals more susceptible not only to the virus, but human rights abuses. In addition, vulnerability is important for us to understand in general when we're dealing with human rights issues, but particularly for COVID-19 as a global pandemic. Vulnerability, for our purposes, is defined as the quality or state of experiencing various types of challenges and hardships and be more likely to be harmed either physically, emotionally, or otherwise because of those experiences. This can include, but is not limited to, things like poverty and abuse, exploitation, food and housing insecurities. It could be the status of children as orphans or foster children. It could be a wide range of discrimination, whether it's for race, gender, and age, and a number of other types of political, social, and economic status. It also can be very much affected by education and employment opportunities. The more education or the more employment opportunities, the less likely that those vulnerabilities are there. Now, our research project I mentioned in the introduction was a one-year study. In this study, we spent basically summer of 2020 to summer of 2021 collecting research. We looked at a number of different data points in a number of different areas, and ultimately have been developing that into this broader presentation and report that we'll be following. This is a comparative study, so it's not an extensive study of every country or every circumstance, but it is a comparative study of some key factors. Health, education, and employment are our focus areas, as well as the 5 countries of varying development levels. So as we mentioned earlier, this comparative study is focusing on health and education and focusing on 5 countries. And I'm going to spend some time this morning talking about those 5 countries to give you a chance to get some context and understand why those particular countries were selected. Our key aspect of this presentation is to focus on these highlights, key issues and key contexts, understanding what those vulnerabilities are, understanding what those susceptibilities are. So we won't have time in today's presentation to go through great detail on any of these particular countries, but just enough to give you some foundation. Our report will go into greater detail. Now, the 5-country study. As we know, we have selected 5 countries, but each one is of varying development levels. Cambodia was selected representing Asia and is a developing country. India was selected as a developed and developing country in South Asia. Mexico is both developed and developing in Latin America. Uganda is a developing country in Africa. And then, of course, the United States is a developed country in North America. We chose these particular countries because of the variations in developing, developed, or semi-developed. But we also chose them because each of these countries represent regions where we have contacts. We have organizations that have worked on the ground. We have some understanding of the nature and the dynamics of each of these countries, and that helped us in terms of conducting some of the research. Particularly in places like Cambodia and Uganda, there's very limited reporting, there's very limited statistics, and so we really needed the on-the-ground information and the anecdotes to help connect some of the dots in our research project. So let me start with Cambodia. For those of you who can see the screen, Cambodia is this country that you'll see in the far east. You'll see it sort of surrounded by some of these other key countries such as Thailand. And what you want to know is Cambodia is one of the centers for human trafficking around the globe. It is an impoverished country. We'll go through some of the details of that, but it's also sandwiched next to these other countries that also have very similar dynamics. Thailand, for example, is one of the most severe cases of human trafficking globally. So a few stats and information about Cambodia. Cambodia is a relatively younger country in terms of its total change from a totalitarian regime for many, many years. It was established in 1993, and because of the Khmer Rouge and Pol Pot's devastating leadership there, this country was ravaged in many different ways, politically, socially, and economic. It has lost all sense of its grounding and its bearing and its history because of that totalitarian regime. And it's now in the process of rebuilding economically, socially, and politically. It's predominantly an agricultural society, and so in that sense, it doesn't have a lot of industry and not a lot of opportunities for people. And there's also a very high degree of discrimination against women, and especially the girl child. This particular society does not value the girl child, and especially girl children who are in poverty or in any form of abuse. There are little or no social services for poor or abused people, let alone these women and children. There's also a high degree of police and government corruption, which makes it very difficult for protections for these vulnerable populations. In addition to what we see in terms of some of the overview of the country, we also want to share the fact that there's some stats that are very relevant for each of these countries. And I want to share with you a little bit about Cambodia. It currently has 16.72 million people that live in the country, in a relatively smaller country. 17.8% are living below the poverty line. Now, that may not seem like a dramatic number, but that's just below the poverty line. Most of the people of that 16.72 are experiencing some form of poverty or food insecurity or home insecurity. The literacy rate is 87.7%, which is not great. That does mean there's a large percentage of people who do not have even basic grade school literacy, which limits their opportunities for employment and other types of needs. Now, this is an interesting fact. 0.31% are unemployed. Now, that might seem like a minuscule amount, but it's important for you to understand that in this agricultural society, 80% of the community is working in the informal sector. As a result of being in the informal sector, they have very limited reporting on anything that they're doing. So this 0.31 comes from only people who are employed and where there are stats. So this is a very important number to understand. There have been 125,000 cases of COVID-19 and over 3,000 deaths from COVID-19 in Cambodia. So moving forward from Cambodia, we want to also move on to our next country, which is India. India is also located in Asia, but it is a developing country that has both very high level development and also very low level development in different parts of the country. India is an ancient country. India is a much more complex country than what we see in Cambodia, but there are some similar dynamics, which we'll also talk about. India was established actually in 1947, so despite having a very ancient history, it's also a relatively new country because most of its history, it has been under colonial rule. It's had both modern and ancient elements, and both industrial and agricultural elements throughout history and currently. Surprisingly, what a lot of people don't realize is India is one of the largest democracies in the world. It is the largest democracy in the world. And yet in this democracy, there's still government corruption, there's still police corruption and other kinds of concerns. A lot of it draws from the fact of high poverty, but it also has high tech. And a lot of the high tech world has some connection to India. India is a diverse country with many religions, languages, and a range of socioeconomic statuses. And it has this unique thing that we call the caste system, which literally is an institutionalized system of discrimination that particularly weighs heavily on poor individuals and women. The population is quite significant. In India, we have 1.38 billion people, which makes it the second most populated country in the world. And by 2025, it's predicted to become the most populated. 20.8% of the people in India are living below the poverty line. So if you look at that population number and to know that 1/5 is in poverty is quite significant. And just like with the Cambodia figure, that's below the poverty line, but most people are still experiencing other forms of loss and limit. 74.4% are literate in India, which means about 25%, a quarter of the population, does not have any type of basic education and literacy. That means also a translation to the employment level. Almost a quarter of the people are unemployed. In terms of COVID, 42.8 million cases of COVID-19 have existed in that country alone, with over 500,000 deaths from COVID-19. Mexico. While we've been focusing on Asia to this point, we also need to understand Latin America has been influenced by COVID-19 in some unique ways. We've selected Mexico because of our context, but also because it's a very significant country within Latin America in general. Mexico, like India and like Cambodia, has interesting histories and backgrounds. It has a longer history in terms of its current government. It was established in 1821, but also after a long history of indigenous and European influences. Similar to India, it has both industrial and agricultural elements. It has a centralized government, however. So while there are, democracies around the world, this one is sort of a hybrid where it may come across as a democracy, but actually runs similar to some of these authoritarian systems that are in other parts of the world. Police and government corruption are quite high in Mexico, and police brutality is well known in Mexico. There's limited social services and supports for the poor and the abused, but in certain pockets of Mexico, particularly in the urban centers, there are some programs. The population is significant, 128.9 million people, but 43.9% are living below the poverty line. That's dramatic. We're reaching almost a half of the population. There's a higher literacy rate, 95.25, that comes as a reflection of that centralized system. And there's about 4.7 unemployment. But again, like in these other contexts, that is reported. And so since there is so much agriculture and informal sector work, that may not be an accurate figure. COVID cases are significant as well, 5.37 million and 315,000 deaths. Uganda is in Africa, and it is a lesser developed country. So it is more similar to what we've talked about with Cambodia. Some of the dynamics of Uganda are similar in the sense of its neighbors as well. Just like Cambodia has Thailand and places that have other kinds of concerns, so does Uganda. You'll notice that Uganda is neighboring the Democratic Republic of Congo as well as South Sudan, which are considered two of the most dangerous places in the world in terms of war, in terms of the refugee crisis, etc. Uganda was established in 1962, and it also had a history of colonial influences and a lot of political unrest. It's mostly agricultural with very high levels of poverty and a really high number of refugees given the situation in DRC and Sudan. With that being said, the stats in Uganda are comparable to what you see in places like Cambodia. There's a smaller population, 45.74 million, but 41%, this is an interesting figure, are below the age of 15, which makes Uganda one of the youngest populations in the world. 21.4% are living in the poverty rate, 76.5% have literacy. And as we saw with parallels in India and Cambodia, that's highly problematic when that proportion of your country is lacking literacy and or means. With that being said, the employment rate is very, very significant to note here. This is an employment rate, not an unemployment rate. 46.65% of people are actually employed. That's a huge number of people that are either in the informal sector or just not having work. There have been 163,000 cases of COVID and over 3,500 cases of COVID deaths. The United States. Now, that selection in this program is important for us because oftentimes we don't realize that the United States has its own sets of issues. Even though we're the world's superpower, COVID-19 has affected our country in very similar ways to other countries. But because we are developed and industrialized, some of how we experience it might be different. The US has a much longer history in terms of our actual governing system. It was established in 1790. And that makes us the oldest democracy and constitution in the world as it stands. And with that, we've also developed into what is referred to often as the global superpower status. We are the most significant political, economic, and social country in the globe. There are other powerful countries, but ours is considered probably the most industrialized and with extensive agriculture. California alone produces enough foodstuffs to pretty much feed the entire country. There's considerable political, social, and economic ranges and divides in this country, and we saw much of that in the unrest following the start of this global pandemic. Our population is 329.5 million people, which does not make us very populated in terms of our size. Poverty rate is lower than the numbers that you saw earlier, but it's still significant for a country of our status. 13.4% of the people are living in the poverty range. 88% literacy rate. Again, it might look comparable to some of these other countries, but considering our development level, 88% is not high enough. 4% unemployment rate, which is much better than most, but again, we'll have to run the numbers compared to the opportunities that are in our country. The COVID numbers are substantial, 78.2 million cases and 930,000 COVID-19 deaths. As we covered all these countries, I would like to now take a moment to step away from these presentations and allow an opportunity for our next presenter to share a little bit more about the health context. So please welcome Emily Winn.
Thank you so much, Sosamma, and thank you all for sticking with us through the tech issues today. So as Sosamma said, I now will be covering a little bit more of the health impacts of each of our focus countries more specifically before we jump into talking about women and children respectively. So as Sosamma mentioned, COVID really did impact the entire world, and the purpose of this section is to detail the worldwide impact from a health standpoint and to highlight the COVID-19 impact in each of our focus countries for this study. Additionally, I'm going to identify 4 key trends from each focus country at a high level from a health standpoint, which Lauren and Greer will talk more about later. So just detailing again, Sosamma did say these numbers, but there are, nearing 500 million worldwide cases of COVID and nearing 6 million deaths. So those are quite substantial and drastic numbers. I also want to mention that it's likely that these numbers are underreported due to the lack of testing and the disparities in testing accessibility across the globe. So in this section, I'm going to go through the cases by country, testing worldwide, variants, and then comorbidities, mental health impacts, impacts of health by gender, and then, like I said before, the overview focus of each country. So just putting these up here, I wrote down the infections and death cases as of March 3rd, 2022 in each of our focus countries. And Sosamma did a great job detailing the populations of each of these countries. And I think it's important to view COVID-19 deaths and infections in the context of population. Because, in India, for example, it may only be a 13% infection rate, but that's millions upon millions of people. And so when we look at testing across the US or across the world, the US does have the highest amount of tests performed to date with 93 million cases. However, India is close behind that with 938 million cases have been tested in the US, and then India is close behind that. However, there has been difficulty finding data about testing, deaths, and infections, especially in countries such as Cambodia, that may not have as strong of an infrastructure set up. And this pandemic has really showed the importance of a medical infrastructure in dealing with situations like this. So I think that's an important thing to recognize. I also want to talk about notable COVID variants. So as you all, I'm sure, have heard, various variants of the disease have emerged throughout the pandemic. Variants do emerge as the virus spreads and the disease becomes more resistant to treatment. So one of those first large ones was the Delta variant that arose out of India, and this caused more severe cases than other variants to date. And then more recently, we did see the Omicron variant coming out of South Africa, which was much more contagious. So according to the BMJ, 9 notable variants have been found since September 2020. Now, this doesn't mean that more than 9 haven't been found, but these are the notable ones that have caused significant differences in testing rates and things of that measure. It's also important to mention that from a health standpoint, those with comorbidities, especially hypertension, diabetes, COPD, and cardiovascular diseases, have been drastically more impacted by COVID-19. And this is due to infection rates, death rates, lack of access to care, and things of those sorts. So yeah, I do have here that those with pre-existing conditions struggled to get access to care during COVID-19 because hospitals were so overrun with COVID patients. So this is a whole other cross-section of the population across the globe that was impacted by the disease. Additionally, mental health issues increased dramatically during the pandemic. A study in the UK showed that there's been a 37.8% of the population that struggles with mental health issues, and this is a 13.5% increase in the last 2 years. So although those mental health issues were there before, COVID-19 did exacerbate them across a large portion of the population. There's also been a pronounced and prolonged deterioration of mental health because of COVID-19. And going forward, this is going to be a specific area of health that needs to be considered and addressed. I also want to briefly touch on the impact by gender. One large area of health we've seen impacted by COVID has been reproductive health across the globe. So there's been an increase in pregnancies in many countries, with young girls staying home from school. Additionally, pregnant women infected with the virus were more likely to be hospitalized than non-pregnant women. And so this was another cross-section of the population that did have struggles because of COVID. Additionally, women have significantly struggled from violence during the pandemic. Before the pandemic, it was estimated that 1 in 3 women worldwide will experience violence during their lifetime. And when I first heard this statistic, my jaw dropped. And when I heard that this increased even more drastically during COVID, it really, put a pit in my stomach. So because of the increase of staying at home, intensified violence and assault for women and girls did happen. And I know Lauren and Greer will talk more specifically about this in individual countries going forward. But I just did put that domestic violence reports and calls have increased by 33% in Singapore, 30% in Cyprus, 30% in France, and 25% in Argentina. So these are not our focus countries for today, but just to show that these issues are being seen all across the globe. So now just briefly touching more specifically at the United States of America. So vaccination in the US currently has progressively increased over time, with 77% of the population having 1 dose of the vaccine. And the studies have shown that these have been decently effective against spreading COVID-19. On a worldwide basis, the US does have a decently high vaccination rate, with 253 million people currently having 1 dose of the vaccine. Additionally, mental health issues in the US have been very significant in comparison to other countries. And a lot of this is because the mental health systems in the US are more established than in some other countries. And so one case study that our research looked at was a hospital in Spokane, Washington, that saw a 73% increase in admission into their inpatient adolescent psychiatric unit. So those are drastic numbers. There was also a 68% increase in the general pediatric floor. So the people in this hospital were struggling a lot more, not only on the mental side, but also the physical side. During June 24th to 30th of 2020, US adults did report considerably elevated adverse mental health conditions associated with COVID-19. And it's also important to note that mental health has impacted all groups of people across cross-sections, ages, careers, but specifically younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers have seen the highest increases in mental health impacts. And they have experienced disproportionately worse mental health outcomes, including substance abuse and additionally elevated suicide. As I said before, there's also been a delay in medical care and reduced preventative visits for those with pre-existing conditions. So by June 30th of 2020, because of COVID-19, an estimated 41% of US adults had avoided or delayed medical care, including urgent or emergency care and routine care. So those are decently high numbers, and studies have shown that because of this delay in care, the increase in non-COVID-19 related deaths and avoidable illnesses will see an increase in the years following the pandemic. So 60% of doctors believe that there was some avoidable illnesses suffered by a patient as a result of not being able to go into the doctor and do routine screenings. Studies have also shown that the pandemic will have a substantial impact on cancer outcomes. So without those routine screenings and without the access to necessary medication in a timely manner, these impacts could be seen long into the future from the United States. Moving on to India, with one of the largest populations and most COVID cases, India is very important to talk about from many different contexts. Talking specifically about health, as of March 3rd, 2022, 70% of India's population had one dose of COVID, and this is 966 million people. So this is a drastic amount, and India has been substantially pushing vaccination all across the country, even through geographic diversity and infrastructure diversity across the country. The second and third wave of COVID-19, so spring and summer of last year, hit India very, very substantially. So I put a graph on the slide here that shows that absolute spike in May of 2021 with daily COVID deaths. So India was ramping up testing at the time, but more and more people were dying from the disease. However, in the single day, India recorded 379,000 new cases of COVID and nearly 4,000 deaths in one single day. So those are very large numbers that I think have quite an impact. There's also an important study that came out of India that showed that 30% of those who died due to COVID had no comorbidities. But it is important to note that the study also mentioned that India has a high prevalence of undiagnosed illnesses in the country. So those that maybe died without comorbidities may have had undiagnosed illnesses that led to those contributions. And 30% died with no comorbidities. It shows the impact of COVID on India's healthcare system. Finally, I'll just say that women in India are facing difficulty and are dying oftentimes when they're pregnant and they're not getting admitted to the hospital in time. And I know Lauren will talk a lot more about the health impacts of India, but there's also been a decrease in access to contraception in India, which will lead to a large population boom, studies have shown. So 20 million babies will be born from January 2021 onwards because 25 million couples did not have access to contraception during the time. And then additionally, domestic violence and human trafficking are issues that India has struggled with for substantial amounts of time, and those saw increases during COVID as well. Moving on to Cambodia, as of March 1st, 2022, 87.6% of that population was vaccinated with at least one dose, which equates to 14.6 million people. So similar percentage-wise, but much less of a population than India, just because of the lower population in the country. In Cambodia, there have been extremely restrictive lockdowns, and for a while, individuals were only able to leave home for medical reasons. And this caused significant issues with getting access to food and medicine and adverse health effects because they were locked at home and could only leave for essential medical care, and sometimes not even then. Cambodia also closed all of their markets in the capital city to decrease the surge in COVID-19 vaccinations. And families had no way to get food for 2 weeks because of this. So this led to increases in malnutrition, especially for those that did not have other sources of food and could no longer go to the market, or did not have ways of transportation to get to other places where they could get food. And then additionally, school closures have had significant economic ramifications on the children in the country. And this is another important thing to recognize. And Cambodia may struggle to get back to the level they were at before because of these school closures. In Mexico, there was a struggle to get COVID-19 vaccines at first, but as of today, there are 66.2% of the population with one dose of a vaccination, and the US, Pfizer, exported vaccines to Mexico after a strong push. And then from here, Mexico was really a leader in getting vaccination to the rest of Latin America and South America, specifically a partnership with Argentina, to really help that spread throughout the Latin America and South America region. In Mexico specifically, it has been shown that obesity represented the strongest risk factor and predictor of COVID-19. And COVID-19 and obesity were not only a predisposition for the severity of your disease, but also those higher infection rates. So that was a significant study that came out of Mexico. And then social isolation and confinement increased the likelihood of domestic violence, like I said before. And in Mexico, this was seen to an extreme level, with the country already having high levels of domestic violence. And then finally, Uganda. Uganda does have a lower vaccination rate than the rest of the countries we've talked about so far, with 29.6% of the population having one dose, which is 13.5 million people. And so largely due to the infrastructure and the organization of medical systems in Cambodia, they have struggled to put vaccination out, but they are continuing to push those efforts as time goes on. Another important thing and a heartbreaking thing to mention about Cambodia is the increases in child labor due to the pandemic. So the closing of schools and the limited aspect of government assistance pushed children into exploitive and dangerous child labor. And so these children, the study showed, were as young as 8 and were having very hazardous work days, cutting stones, cutting down sugarcane fields, and getting physically injured while doing this job, working 10 hours a day, sometimes up to 16 hours a day, 7 days a week. And all these children are doing all these things because their family does not have the same access to a necessary income that they used to before the pandemic. And these children are learning less than $2 a day for all the work that they're doing. So this is a significant issue. There's also been a lack of access to healthcare in Cambodia or in Uganda because of COVID-19 overrunning the hospitals and them just not having as strong of an infrastructure system that was needed to deal with this pandemic. And so there was also a significant disruption in access to reproductive health services because of these things. So that was a fast and furious overview of the health impacts across the globe and across our 5 countries. As I said before, Greer and Lauren will go more specifically into the areas Sosamma mentioned, but just some concluding thoughts here. There have been drastic but differing impacts of COVID-19 on each focus country, and no country reacted to COVID and saw the impacts in the same way. Additionally, those already in vulnerable groups experienced significantly more detrimental impacts due to COVID-19. So with that, I will invite Lauren on the screen to detail each country and vulnerable group of women more specifically. So thank you for listening.
Thank you, Emily. So like Emily said, I'm going to do an overview of women as a vulnerable population and the consequences on women. Like Sosamma started out our presentation with, when we're talking about vulnerable and women as a vulnerable population, it's really about women being in a quality or state of experiencing hardship. So just want to highlight that right off the bat, not that women themselves are vulnerable, because we know very well, especially at this Women Empowering Women event, that we are very powerful individuals, but sometimes situations around us create vulnerabilities and are a state of experiencing hardship. So first, we are going to do an overview of women and what we've experienced due to COVID-19 policies. And then we're going to go into each country specifically. So when we're first looking at women as a vulnerable population, we've seen that economically, overall, women have faced the brunt of COVID-19 policies due to the fact that women overall earn less, they're saving less, they have less job security, and they're less involved in the formal sector. Women in general do face greater demands at home, and with school closures and employment, this is especially felt. They tend to do 3 times as much unpaid work as men and carry the burden of being family caregivers. School closures again have added to this burden, as there's been greater need for women to care for children and to provide for their education. And as a result, there has overall across the board been increases in poverty and lack of female participation due to the labor force. And due to the COVID-19 policies and its impact on women, the United Nations has estimated that about 435 million women and girls will live in extreme poverty, and that this number will not return to pre-COVID-19 levels until at least 2030. Which is very alarming in a lot of reasons. So here on the screen, as we're looking at, COVID has exacerbated employment, education, mental and physical health, and safety. And I added safety when we're talking about health, because women often face challenges related to health and their safety. So in terms of employment overall, the double burden that has been placed on women during the pandemic means that they're doing nearly 3 times as much unpaid work than men. And so this is increased substantially during the pandemic when people got sent home from work and school. Existing gender norms all around put an increased demand for unpaid childcare and domestic work on women. And for women, it was also more difficult to find work and stay at home. The Institute for Women's Policy Research found that women have experienced the brunt of COVID-19's impact on the workforce and have faced overall 60% of the job losses. And this is due to the fact that women represent a majority of workers in the service sector and other workforces that are deemed non-essential during COVID-19 and the policies. And again, women have had to balance their work with taking care of children. The closure of schools made this even more difficult for women who are, especially those who are single mothers. In education overall, education for women and girls has become less of a priority, and the policies have made it more difficult for girls who have difficulty with access to technology to receive education. And this, as we know, creates greater risk for girls as they grow into women. Girls are at greatest risk of never returning to school, and as a result, they are more likely to suffer gender-based violence, early marriages, and child pregnancy. And when we turn to overall mental and physical health, as Emily already indicated, there is an increase in domestic abuse and physical violence. And unfortunately, this has been labeled a shadow pandemic by the United Nations because of how great the increase in domestic abuse and physical violence against women has grown during this time under COVID-19 policies. And I thought this was really striking that the economic fallout of abuse and domestic violence towards women is significant because the total cost of violence against women would amount to $1.5 trillion. So even if you don't consider violence against women to be a problem, economically speaking, that should also get your attention. And also, as Emily indicated, pregnant women have been left more vulnerable. Overall, there's a lack of routine care and checkups because resources are being focused on COVID. A lot of women are having to choose between giving birth at home or giving birth in a hospital, oftentimes without a spouse, or facing policies and procedures that make them have to make some decisions about how they're going to move forward with their birth plan. And also as a result, routine medical checkups have not occurred both for pregnant women and other non-pregnant women. And this is true especially in marginalized communities. And there's also an overall mental health decline that we're seeing as well when we're talking about health and women's health. Again, when we're talking about safety overall, as Emily indicated, there is an increase in domestic violence. This is due to the policy of lockdowns, and often women have nowhere to go, and there is a general rise in domestic abuse. And unfortunately, some reports are indicating that about 70 cases of the causes of violence were associated with policies and stressors from policies in response to COVID-19. And strict lockdowns again made it difficult or impossible for women to get help. There's also been an increase in sex trafficking and other forms of labor trafficking. Unfortunately, when girls and women are out of school, they face a greater risk of sexual abuse and exploitation. And this goes hand in hand with economic difficulties and job loss, which has made women more vulnerable to exploitation. And femicide has also been on the rise in countries such as Mexico, where instances of femicide was already high. So now we'll turn specifically to look at the United States. First, we'll look at education and employment. So for the United States, in regards to education, women graduates have struggled to find employment and repay student loans. This is significant because 2/3 of loan debt is held by women. And tied to a decreased childcare options, women who are also getting educated are having more difficult to continue their education while also staying home and caring for their children. In regards to employment, women are more likely to be essential workers in the healthcare and the service areas, and so they increased their exposure to getting COVID-19 due to their employment. On the flip side, women also suffered more than half of pandemic-related job losses. And at the same time, women are also facing unpaid work that has increased substantially to the point where some have had to quit their jobs or cut back hours in order to take care of their families under these policies. In regards to mental health, that's also, we're going to turn to health and safety now. Mental health, women have been suffering a decline in mental health. A poll conducted in July of 2020 shows that 53% of adults in the United States reported that their mental health had been negatively impacted because of worry and stress over the virus. This was an increase from the 32% who had reported mental health impacts in March of 2020. For women specifically, the poll showed that over half of women and children under the age of 18 reported negative impacts to their mental health due to worry and stress from the virus. Looking at women's safety, their safety, there's been just a general increase in domestic violence within the home and an increase in sexual violence against women. And unfortunately, this is due to the fact that COVID-19 policies made it significantly harder to escape situations or receive care and get help away from their abusers. Back to physical health, there's routine procedures such as mammograms that decline substantially because of access to healthcare, even in the United States. Women were also, again, more likely to be exposed to COVID-19 because of working in the health fields. And we also saw in the United States that pregnant women faced an increased risk with more maternal mortality and hospitalization. And like Emily mentioned, even in the United States, there was a struggle for women to get reproductive health services. If we now turn to Mexico and education, in Mexico, women had been burdened by school closures since in Mexico, about 3/4 of unpaid care work is done by women and mothers. And again, girls' education was affected by technology gaps and other concerns that affect girls, such as increased domestic violence. With employment, women have had an increase in Mexico with the double burden of having to balance work and caring for their family. Women in Mexico had already been facing the worst economic prospects in Latin America even before COVID-19, and so this has just only increased the struggle of women with employment in Mexico. Unfortunately, women in Mexico face the majority of job losses during COVID-19. It's estimated that about 2/3 of job losses during the outbreak fell on women. And as a result of the job loss and closures, there's just been an overall increase of sexual exploitation of vulnerable women. And so in each of these countries, you can see how when women are affected in employment, it affects their health, their safety, and economically they're affected. It makes them more vulnerable, which is a theme that you're going to see, unfortunately, throughout each of these countries. With physical health and women's safety, Latin America already had the highest rates of violence for women around the world. And in Mexico specifically, domestic violence reports increased substantially. There was a 5% increase in those who were seeking shelter. Again, there was an increase in domestic violence and killings of women. And what was alarming was while the instances were increasing, the reporting was decreasing. So it's likely higher numbers than were actually reported for instances of domestic violence and killings of women. And alarmingly, for Mexico, gender-based violence has claimed more women's lives than the number of female victims of COVID-19 in Mexico. When I first read that, it took a little bit to sink in, just the significance of that number and fact for women in Mexico. In another interesting aspect of Mexico with women's safety is that those who were applying for asylum at the Mexican border increased. But as a result of COVID policies, the budget for granting those requests and dealing with immigration concerns did not increase. And with Mexico, before the COVID-19 pandemic, there was 7 femicides a day, or that's what they estimate. And after COVID-19 and the policies with COVID-19, it's estimated that increased to 10 a day. So policies dramatically affected women's safety and health in Mexico. We'll turn to India now. And with India, in education, overall, COVID-19 policies is undoing progress towards girls' education in India. And part of this is due to the culture, but also access to technology, which made virtual school more difficult for girls than for boys. With employment, India has one of the largest gender gaps in the labor force in the world, and very significant patriarchal norms make it difficult for women to find and keep work a lot of the time. But when COVID-19 hit and the policies were enacted, work from home in India was not as embraced. And this in turn has affected rural women more significantly than urban women, unfortunately. And we'll turn to mental health and physical health for women in India. Unfortunately, there's not a lot of data available with mental health, and that is very disappointing to see. With physical health, there's millions of girls and women estimated to have lost access to basic healthcare services. As Emily mentioned, this includes reproductive health services. And there's likely going to be, as she said, an increase in births, which connected with India's culture of disvaluing women and girls. There is likely going to be an increase in femicides of girls, unfortunately. Again, access to healthcare has decreased, and preventable diseases and conditions have led to higher mortality rates for women. In regards to women's safety, crime against women in India was already very high, 1 every 1.7 minutes, it's estimated. Domestic violence against women increased, as is the trend with all these countries. But again, there was a decline in the number of violence, which means that the actual rate of violence is likely much higher. And again, sexual exploitation and human trafficking is expected to increase because of COVID-19 policies that have made women and girls more vulnerable to exploitation. If we turn to Uganda, we're going to look at education and employment. And for girls in Uganda and younger women, the impact on school closures include that they will drop out of school, child marriage rates will go up, and there's going to be an increase in young pregnancy. And unfortunately, the longer it is that schools remain closed, the more likely it is that a girl will not go back to school. And so as a result, COVID-19 policies have only intensified gender inequalities in Uganda for schoolgirls and young women. With employment, women working virtually have had a struggle to balance work and household responsibilities because, again, there's the double burden on women who do work from home or who have lost their jobs and are trying to provide for their families. There's a struggle of meeting increased needs of their home and balancing work if women are able to keep their jobs. And turning to health, physical health of women in Uganda has been greatly impacted by policies of COVID-19. Like the other countries we've already talked about, maternal health care access decreased. There was also limited visitors in hospitals post-delivery for women making it just difficult emotionally for new mothers who don't have that access to their support of their family. Other health concerns such as HIV and AIDS increased, and those who are living with chronic illnesses like Emily talked about. And unfortunately, this is due to partially to an increase in the cost of food and other policies that force many to choose between eating and receiving health care and the care that they needed for these other health concerns other than COVID-19. In regards to women's safety, there is a shutdown of routine health services such as reproductive health. And again, there was an increase in reports of domestic violence. And now we'll turn to Cambodia. And in Cambodia, unfortunately, as a country, there was not as much data or resources available when it came to women's and girls' education in Cambodia and its impacts on women. As for employment, women in Cambodia account for 48.3% of the total labor force. And this is significant because of the pay gap for women. This was already pretty large before the burdens of COVID-19 policies were implemented. And most alarmingly, well, there's a lot that's alarming when we look at these implications for women, but for Cambodian women, progress for Cambodian women is said to have gone back about 10 years in Cambodia, which is very striking. And equally as alarming is that the economic impact of employment loss on Cambodian women due to COVID-19 policies. There has been an increase in sexual exploitation overall, but specifically in one instance, Cambodian women who are trafficked in China for what they label marriages, but is just sexual exploitation. It's increased in number. So even though this bride trafficking is what it's referred to, was made illegal in 2008, women in Cambodia have remained vulnerable to this exploitation, and it's only increased with COVID-19 and the effects of COVID-19 policies. So although this is more connected to women's physical safety, it is directly linked to the economic consequences and employment loss due to these policies. And turning to health, and again, mental health for Cambodian women was difficult to come by, unfortunately. With physical health, the nearest healthcare center can be upwards of an hour away, making access to healthcare difficult and almost impossible for some, if not many, women. And like Emily mentioned, restrictions on movement made this even more difficult for Cambodian women. And again, pre and postnatal care was very difficult to access. This was just an increased difficulty during COVID-19. As far as women's safety, women and girls are at further risk for domestic violence due to the culture and limited power within the home. And there was also an increase because of the fears, the violence of those who they would be living with due to COVID-19, and the confined spaces they were subject to because, again, of stay-at-home orders. There was also a heightened risk just of sexual assault and violence, specifically intimate partner violence. And as a result of the economic consequences and the safety issues, there was many women who were driven to inadequate and unsanitary housing. So that's a lot of information. I was trying to talk really fast to get it all in. There's so much more in our report. But just some concluding thoughts before Greer continues our discussion with implications for children. It's really just talking about each of these countries. There's just a theme going through each of them, and it shows how COVID-19 policies and procedures have made women and the vulnerable just more vulnerable. Women and girls have borne the brunt of a lot of COVID-19 policies due to cultures and due to abuses that were already in place that these policies and procedures increased the vulnerability of women and girls. Physical and abuse and domestic violence increased overall because of these policies and just the other factors going into these individual lives. And mental health of women was really underreported, which is concerning, considering how just on an individual basis, we know that this period of time has been mentally draining on everyone. So hopefully future policies and procedures for COVID-19 or future pandemics will consider these implications and consequences for women and vulnerable populations. And with that, I will turn it over to Greer, and she will continue our discussion focused on children and the implications for children.
Good morning, everyone. Thank you, Lauren, so much for that information and introduction. As she said, my name is Greer, and I'm going to be presenting today on the impact of COVID-19 for children. So first, I'd like to start off with establishing why children are a vulnerable population. And many of you are probably parents, your aunts, your uncles, grandparents, or maybe you just have friends with children or know someone or in some way have children in your life. Depending on what country you're from and what culture it is in your area, the degree and age of independence of children, either chosen or necessitated, will vary some. But the collective understanding is that really childhood from birth until adulthood is that children require care, having food, shelter, and personal needs provided for them, making them not only just a vulnerable population, but arguably children are the most vulnerable of any population. What COVID-19 has exacerbated amongst children is also reflected greatly in what we've previously heard that's impacted women. We're going to discuss poor nutrition, domestic violence, and increased child abuse, the effects on education, and mental and physical health. Next up, I'd like to discuss the countries that we studied. As with the previous presenters, this focus of the presentation is going to be the 5 countries that were mentioned and specific to the year 2020. And again, it's the United States, Mexico, India, Cambodia, and Uganda. Starting with the United States, let's talk about education. It's believed that despite varying efforts to adopt hybrid schooling approaches, a staggering number of children in the United States fell behind the equivalent of an entire year of education. In Los Angeles, for example, at least 40% of students never engaged in their established remote learning classrooms, even just once. That one really hit home because that means that they didn't even have the attempt to try, right? And so many of us are used to being on the internet as we are today right now, and we're able to do these video conference calls. And up to 40% of students in Los Angeles, which is a very developed area, never even have the ability to log in even once. Imagine then that percentage growing for students that logged in maybe only twice, 3 times, or maybe even just once a week. Realistically, only those children with support systems and resources to keep them scheduled for their class time, logged in, ready to learn, and didn't fall behind were those that had very strong support systems, parents who were maybe working from home or who were not working but still had income from a second parent or child care provider. Overall, the lack of normal structure severely limited the activities and educational opportunities that enable children to thrive. Next, I'd like to discuss the mental health of children in the United States. We saw a vast array of mental health issues starting in infants all the way through adulthood in children, but Separation anxiety was severe for toddlers, and as we came out of 2020 and into 2021, there was an increased dependence and fear of returning to normal because routines were so disrupted that children were not emotionally and mentally prepared for what life after the pandemic or in a hybrid post-pandemic world might look like. The increase of fear and nightmares, loss of appetite, attention, and security increased greatly amongst children in the United States during this time. The physical health of children in the United States also declined, with a decrease in opportunity for exercise, creating negative long-term habits. Many were forced to stay home and inside with lockdowns and lost the extracurricular activities and recess times that came with doing education outside of the home. This led to an increased risk of obesity, cardiovascular disease, and an uptick in diabetes in young children in the United States. Many were impacted with social awkwardness, and that is coupled with fear of being around other people and having less healthy interactions with peers, greatly impacting the overall physical health of our children. Safety in the United States. With the change in children's routines, the general safety of children also decreased in two ways. The increase in online presence for children as young as kindergarten also came with an increase in the risk of safety for threats in the cyber world, as well as also threats in person, where the population of children increased their risk of general physical safety with no resources in the form of teachers or routine exposures to adults outside of the home to identify and report on physical or emotional abuse. We saw an uptick in domestic abuse, including child labor, teen pregnancies, and sex trafficking in the United States. Let's talk about food security in the United States. Staying home and away from school programs increased the overall insecurity of food to as many as 2 out of 5 families with children becoming unable to regularly access the basic necessity of food. Now, if we stop and think about that, the United States is, as Sosamma said, arguably the most developed country, the most premier country when it comes to our resources. To have 2 out of 5 be such a significant percentage of families that were food insecure due to this pandemic is really heartbreaking, and alerts us and keep that number in mind when we talk about other countries that are underdeveloped and think about those statistics of what's going on in the United States with the lack of government assistance and availability and accessibility of programs for children that relied on school for their meals, resulting in an increase in the application for SNAP or the food benefits from the government. All right, so we'll start next with Mexico, and we'll start again with education and mental health. Mexico did launch a program called Learn at Home. It was a combination of internet hybrid learning. It included public television programs and radio programs as well. So it was great to see and read about Mexico taking a strong effort to try and provide education during the pandemic. However, the underserved middle and lower class were not actually able to benefit from that program, as they did not have either access to the internet or computer technology at home, or they were simply forced to work to try and provide for their family as well. So their education fell to the wayside, even with the attempts of the government to provide some sort of education. All of this results in mental health issues for children when they are now acting as providers for their family, the breadwinners, if you will, where every person in the family is required to work, and a lot of these are, off of the reporting charts for statistics when it comes to employment, and they're doing very grueling manual labor. It affects the amount of abuse that children were experiencing in Mexico, and again, the food instability is just reiterated by the fact that children had to work themselves and grow up much faster during this time. Malnutrition, as I mentioned, and the food insecurity is expected to get worse before it gets better in Mexico. And Mexico's National Public Security System reported that in the first 3 months of 2020, domestic abuse increased with 54,000 domestic violence investigations opened, which was both women and children. And as Lauren had mentioned, the abuse against women is staggering, but for everything that happens to women, there's likely a child that is also affected by that. And what happens to a child's mother then reflects and happens to them in regards to their ability to be provided for and protected. Also throughout Mexico, it was known that COVID-19 cases and death were underreported by about 60%. So we don't know the full impact of the deaths of COVID-19, which impacts the overall physical health of children and how many actually were exposed to or came ill from COVID-19. In regards to safety, many parents had to leave the home and children were left watching children or sent to work again. Femicides in Mexico, there were thousands reported within the first few months, including children, not just women. And again, an uptick of child abuse we're seeing across all of these countries. When everyone is stuck at home, there's often multi-family homes within communities in Mexico, and there's not enough space for everyone to thrive, and abuse tends to rise in those situations. All right, moving on to India. Speaking about education and mental health, the existing caste system created an even increased disparity in opportunities for education throughout India. There was a staggering increase in the number of orphaned children who lost their parents to COVID-19 and then had to live on the streets and had zero access to education, and the high dropout rates of children in India have continued to increase exponentially as children essentially fell off of the radar of the government system. Unfortunately, in India, there's no access to internet if you don't have a stable home, and we saw that affect the mental health of children throughout India. In terms of physical health and food security, almost 1 million severely malnourished children ages only 6 months to 6 years have been identified. There are thought to be more, and an understanding that COVID-19 will continue to exacerbate this problem, with there being widespread severe acute malnourishment. India saw a drastic increase of numbers of COVID with the second wave, and that resulted in even more orphaned children who were not provided developmental milestones because they were unsupported both in education, physical milestones, and it has seen a drastic increase in the number of street children, as they are referred to, who are required to find their own food. There are often soup lines or just an increase in theft and children doing whatever it takes to try and find their next meal. As you can imagine, the safety of children in India is dire, given that so many children are left to fend for themselves because they have either been orphaned or abandoned by parents who have had to leave the home to go find work elsewhere, which has led to a staggering increase in child trafficking and child labor, as well as illegal adoptions, even to those that might aim to do well by trying to adopt and bring Indian children to the United States even, but not being able to follow the proper channels and make sure and ensure that those children are safe along the way. In Cambodia, the government also, like Mexico, attempted to create an educational program over the television. And it was really encouraging to read about it and to know that there was some sort of access to education for children in Cambodia. UNICEF also joined efforts with Cambodia to create an e-lessons program and even a radio education program. However, the mental health due to domestic abuse, food insecurity, depression, anxiety, and what we're seeing throughout the world amongst children has still increased because these resources don't reach far enough and they don't reach the most underserved populations. In terms of physical health and food security, in Cambodia, corporal punishment is allowed, and we saw an increase in the hotline calls in Cambodia, particularly seeking support for COVID-19 related concerns, lack of food and safety. As we know, Cambodia is a hotspot for human trafficking, and the physical health of the children in Cambodia is greatly impacted by this, either by being trafficked themselves or by their parents or siblings that take care of them being trafficked. In terms of food security, malnutrition and lack of access to food is amongst the highest rates in the entire Asian Pacific area, with about 32% of children under 5 identified as stunted, and even 10% being identified in the terms of wasted. So this is what is happening for just under age 5, the most vulnerable of children. Again, with safety, we saw that increase in human trafficking and higher rates of child marriages, increased child-teen pregnancies, and poverty and domestic violence increasing along with those numbers. In Uganda, we'll start with education and mental health again. 1 in 100 children in Uganda had access to online education during the pandemic. Nearly 90% of students in sub-Saharan Africa do not have access to household computers, and 82% lack access to the internet. In order to try and continue educating students, Uganda kept schools open actually through the pandemic in many areas, but with stricter regulations. And what this resulted in was students being turned away for not having the proper personal protective equipment, such as masks. So even with the efforts to continue the increased education in person, that was not effective because they weren't able to still serve that population of children who did not have the access or finances necessary to obtain personal protective equipment, or the fees were not paid by parents anymore that were sending children to school because of the increase in poverty and the lack of ability to earn income. So we saw dropouts across Uganda, again, without having any access to online education. The number of people in Uganda who reduced the food eaten, were unable to eat healthy food and consumed less diverse diets, or were worried about not having enough food, increased at varying points throughout 2020 from 30, 35, 45, and 50% during the pandemic. Uganda itself lacked the funds to be able to assist families in rural communities with food insecurities. Only a mere 12% of the population of Uganda was able to receive food assistance. And the rural areas have the highest percentage of poverty in the country. 28.5% of children are suffering from chronic malnutrition, along with 43% of adults who were moderately or severely food insecure. And these are the adults that are supposed to be providing for the children who are they themselves food insecure. Children often relied on schools for helping meals, and when that closed, like other countries, they no longer had access to these healthy meals. As of February 2021, 34.1% of people in Uganda had sufficient food intake. Safety in Uganda, trafficking has increased, and it is so common that the border patrols were struggling to decide which children are needing to get help with being trafficked, or if they're just poverty stricken. It's hard to identify what is actually going on. As the orphan rates increase, children may not be trafficked. They might just not have any care, which again is circular and allows them to have more opportunity to be trafficked. Poverty increases the risk of safety to their physical health, along with abuse, sexual harassment, seeing again the exposure of young girls being unprotected by mothers who are not there anymore to protect them. And there's a 24% rate of teen pregnancy, which is one of the highest in the world. And along with teen pregnancy, 40% of the girls in Uganda dropped out of school to get married before the age of 18. And unfortunately, once married, these girls face violence in the home. So with that, my concluding thoughts on the effect of children is that the most affected are the middle class and the lower class. Education is falling and poverty is rising. Safety decreased and overall health declined. And we saw a lot of common threads amongst these countries, both developed and developing countries, seeing mental health amongst children and stunting of both their physical thriving health and mental health, along with their education and overall safety, unfortunately. But next up, I believe Sosamma will be able to present to us some concluding thoughts, and we'll have time for questions and answers. Thank you.
Thank you so much to Emily for sharing with us this health overview of COVID-19 around the globe. I also want to thank so much both Lauren and Greer for giving us a little deeper dive into what's happening with women and children around the globe with those unintended results from COVID-19. What I want to do now is take a few minutes just to wrap up with some implications and recommendations. All of you that have been watching in person or online have gotten a lot of facts and figures, and it's a lot of information to take in this presentation. We will be following up this presentation with a report that provides more detail, but we want to make sure to leave with you today a good sense of what the key implications and recommendations are. Implications. One of the key factors that we need to keep in mind with COVID-19 and vulnerability is global poverty. Global poverty has been around since the beginning of time. It has increased and decreased in various areas through the years. But in these COVID-19 years, we've seen a significant increase in poverty. In fact, what we are seeing throughout the globe is that it has increased to 9.5%. That is almost a 2% increase from 7.8% that existed prior to COVID-19. That's a significant amount of concern for the globe. That 2% increase, or close to 2%, will have an impact on every single level of vulnerability that we see around the globe and many of the issues that you've heard in the presentations prior. What we also need to be aware of is that both developed and lesser developed countries at various stages of industrialization and agricultural practices have all been affected by COVID-19 and these years of covering this pandemic. Even in the ones that are more developed, we are seeing some extreme and oftentimes difficult situations, and that includes even places like the United States that's very advanced. Many of the vulnerabilities that we're most concerned about in this study are due to the lack of employment, education, and health opportunities, and safety nets. These safety nets can be affected by many different things and can also be exacerbated by other circumstances such as civil strife, natural disasters, etc. Think about some of the natural disasters that have happened here in the United States in this period of time, and then consider all of the others that have happened in other parts of the globe. Both developed and lesser developed countries have corresponding concerns such as human trafficking. It is not necessarily related to simply being a developed country or lesser developed country. Human trafficking and other types of related exploitations exist in all regions of the world, and vulnerable populations are affected whether they're coming from a developed or lesser developed country. While developed countries have safety nets and other types of sources of supports, and oftentimes better online systems for education, employment, etc., the reality is even developing countries have difficulty accessing and providing these kinds of services to remote areas, particularly rural and poverty-stricken areas, both urban and rural. So even here in the United States, there are many people who cannot attend online school or do online employment quite simply because they either don't have computers or don't have internet service or other means to access them. And finally, another key thing to take away is that women and children, particularly those who are poor, are the ones that are disproportionately affected by every ill, and particularly COVID-19. There are many types of abuses that we just touched on and various kinds of violations that have happened, but COVID-19 has made all of those things worse. When people are forced to stay home from work and or from school, it raises the instances of things like domestic violence that you've heard in the presentations today. It also means that people outside of the home are more susceptible to issues like human trafficking or other types of abuse. No matter how we slice it, the various social, economic, and political concerns that we've seen with COVID-19 affect individuals that are vulnerable more so. There's a few recommendations that we want to highlight. Each of these are much more detailed, but we want to just at least give you the overview. First and most important for our purposes in this research study is that we need to continue to study both developed and developing countries. This one-year study was one entire year, and yet it did not even scratch the surface of the things that we need to be most concerned about. One of the biggest challenges we had with this particular report and this research study was that there wasn't enough accurate COVID-19 reporting. So while we had figures from certain places, there were very limited figures in other places. And sometimes those figures were not even accurately reported. Sometimes they were overreported, sometimes underreported, but we really need to get a better sense of the accurate figures to have a better sense of the impact of COVID-19 and our related practices for many groups, but particularly women and children in those vulnerable populations. We also need to build awareness of short, medium, and long-term impacts. So there may be immediate concerns that we have for health and containing the particular pandemic, but there are longer range impacts that we need to also be concerned about. When children are not able to access school, when employment opportunities close, when poverty increases, the longer term impacts of those things we may not know now, but we will see the results of very soon. So it's important for us to start building awareness and start to track where we could potentially see trends and other concerns. We also have to have a heightened awareness of vulnerabilities and indicators. Some of those we covered today, but the key is for all of us in our communities to be aware when people are living in poverty, when they're facing other types of concerns that can heighten their problems. We need to have increased vigilance, and that vigilance doesn't just come from government or social service agencies, it's also individuals, community groups, advocacy organizations, law enforcement. We all have a role to play in protecting vulnerable populations in all contexts, and particularly now in the COVID-19 context. We also have to review and distribute safety net resources. And those resources isn't just about distributing monies. It's also about creating incentives to increase employment and educational opportunities. By having more people have those opportunities in safe and good environments, that allows them to avoid many of the vulnerabilities we talked about. Obviously, we need to have increased support for basic health care, and not just basic health care in terms of treating the disease or treating other diseases, but it's actually providing basic necessities so that people can be more healthy and prevent them from actually getting these illnesses such as COVID-19. And finally, increase support for and collaboration with various types of social service and advocacy organizations. Global Justice is an organization that provides work and research and other types of supports as a resource to these groups. But we need to see more people allowing these groups to succeed in their endeavors, and that requires a community approach to supporting them. Now, as we conclude this, I do want to provide a little bit of information that you can just use as a reference. One of them is our work here at Global Justice. We are here to inform, impact, inspire the generations to learn, lead, and do justice together. We provide things like this research project. We do a lot of other types of services, and we want to encourage you to not only lean into this work, but to also be able to share with others. This particular presentation is being recorded and we'll be sharing it online. So if you are not able to be here in person or watch live online, you can share this recording with others. You can also send us follow-up inquiries through our email, follow along for upcoming work that we're doing through our website, whether here at Micah Place, which is our now new location in Loveland, or through supporting organizations in our global market. We also have social media outlets that give you lots of other updates, not only about this COVID-19 presentation, but many other advocacy opportunities. And finally, we want to thank all of you. This is 2 hours of intense time and information, and we appreciate each and every one of you that are joining us today, both online or on site. I also want to take this opportunity to thank again Emily Winn, our Outreach Associate, Greer Newman, our Children's Advocacy Program Associate, and Lauren Moustakas, our Women's Advocacy Program Associate, for their work in this presentation. But I also want to thank some key people who are very involved in our research. First of all, Julia Keswin served as our key researcher for this COVID-19 project, and particularly on our women's issues. And so we want to thank her for her extensive work for that 1 year of study. In addition, we received supports from Hannah Kaufman, who also provided a great deal of research support for our children's advocacy work. We want to also thank Evan Gillespie, as well as Yevgeny Pizlar, for their supports for research related to our health components. It really did take a team to put together this work, and this work will need to continue. So we hope many of you will continue to support and engage us in this type of research and other research that helps support advocacy, community members, as well as the pursuit of justice worldwide. So as we transition to our Q&A time, we want to thank you all for joining us in this session, and thank you for your willingness to join along in all the information that we provided today. Thank you.